Yes, so the pandemic sort of boosted the use of telehealth. We didn't have any tools to deliver care without being in contact with the patient. So telehealth became a very important part of care delivery during pandemic. But once the pandemic ended, we were all not sure about the future of telehealth. But we all knew that it's a useful tool, and we didn't want this to go away. So I was thinking, about I used to get regular data about patient experience scores for telehealth visits, and I knew that we had very good telehealth visit patient scores. So I wanted to compare them to in-person um, patient visit scores. And I thought a standardized way is already there, the Net Promoter Score that was being used at our hospital. So I thought, the Institute of Healthcare says the triple aim is, patient experience, improving population health or outcomes, and then access to care. So outcomes are more difficult to measure. Access with in-person and telehealth was something that was not readily available to me, but the patient experience, which is one of the three goals of providing good care, was easily available to me. So we decided to look into that because we really want telehealth to stay. And, if it can provide, non-inferior experience as in person, then it would sort of publishing that data would give more assurance to providers as well as patients. So that was the reason I started looking into this.
So talk a little bit about some of the findings that you observed, what stands out from a clinical perspective, and just give a little bit of detail behind those.
Sure. So we looked at the NPS score, the Net Promoter Score for telehealth visits and the inpatient visits. So this is not every visit, it's the ones where we got a patient experience score back. So we had approximately like 2,800 patients in person and 635 telehealth visit encounters between March 2020. That's when the pandemic began, to March 2024. May 2023 was when the pandemic was officially declared to end. So we had pandemic as well as post-pandemic almost 10-month data to compare to see where there was any difference. So what we found was that actually telehealth, the NPS scores were higher for telehealth, statistically significantly higher for telehealth during the pandemic, and more so for epilepsy patients also. So, because we are a special interest group through Pediatric Epilepsy Research Consortium, so we did want to focus on epilepsy. And then post-pandemic, they were not statistically significantly higher, but they were non-inferior also. Like they were as good as in-person visits. And then the other thing we did was we did a matched analysis. So say some patients had both telehealth and in-person encounters. So we wanted to see among that group of patients, did they rate in-person better or they rated telehealth? And we found that they were equal, like there was no difference. So I thought that this was a interesting conclusion that, telehealth patient experience is as good as in person, if not better, you know. So that was the main finding from our studies. And, the point is that it is a great tool in our toolbox to deliver care, and that's more intuitive, like that's what I feel, but now we have data to prove that, to support that. So I think that was the reason we did this study.